it remains to be seen, okay? Because HIPEC basically was developed by the colorectal and appendiceal cancer surgeons. They were the ones who started using it, and they popularized HIPEC. In ovary cancer, HIPEC is a secondary adoption, based on a lot of work done by the colorectal and appendiceal cancer surgeons. And I have to tell you that they published within about the last 2 to 3 years, their biggest randomized control trials, the largest trial they ever did. It's called PRODIGE 7. It was presented at ASCO, I believe, about 5 years ago, but it's only recently that they published the results. It was a negative trial, which was a randomized control putting patients either to go into chemotherapy, patients with, advanced intraperitoneal carcinomatosis, like appendix and colorectal cancer, they randomize them between, getting standard of care, which was chemotherapy and obviously do surgery if appropriate, versus doing surgery with HIPEC. And the surgery with HIPEC arm did not look better, did not do better than the arm without HIPEC. Now, in ovary cancer, there was one study from Holland, which looked at HIPEC in interval cytoreductive surgery, and the people randomized to interval cytoreductive surgery and HIPEC in that study, which was, they gave the patients chemotherapy, and when it came to interval cytoreduction, they were randomized. So one arm would just get their surgery and get additional chemo after, whereas the other arm got their surgery with HIPEC and then more chemo after. And the arm in the Dutch study that got HIPEC did better. However, that is the only study that we have that has demonstrated that finding. And more importantly, the toxicity did not look worse in their HIPEC arm, because one of the most important, I should say, most feared things about HIPEC is because it can be incredibly toxic, and especially kidney or renal toxicity. And that wasn't seen in that study. So I am aware of all the studies that are being planned or maybe being initiated, looking at HIPEC in ovarian cancer. And it will be nice if the results of the Dutch study are confirmed by these subsequent studies. I think that would make an impact on whether this strategy will be adopted or not.